Thanks to everyone for joining us today. Reducing health inequalities is a priority of the National Cancer Strategy and indeed the Healthy Ireland framework that we are all well aware of. Health inequalities are associated with poor symptom awareness, delayed presentation with symptoms, and low uptake of services, including screening. While the relationship between deprivation and cancer is multifaceted, certain cancers are more likely to be diagnosed in deprived groups. Much of this inequality relates to higher smoking rates in deprived populations, resulting in higher incidence of smoking related cancers. The National Cancer Registry's report from 2016, Cancer Inequalities in Ireland by Deprivation, Urban, Rural, Status and Age, reports a statistically significant higher cancer incidence in the most deprived compared with the least deprived for three cancer types: lung at 60% higher, stomach at 40% higher, and cervical at 120% higher. In addition, people living in geographic areas with higher levels of deprivation are more likely to have higher cancer mortality rates once they are diagnosed, 40% more likely to die from their cancer within 5 years of diagnosis, according to the NCRI report above. Understanding the Challenges of Cancer Report 2022, seen here, looks at understanding the barriers to earlier diagnosis faced by vulnerable patients and the barriers affecting cancer recovery and survivorship, among other things. A link to both reports will be provided in the post-webinar email for further reference. Just to give some examples of projects that we have been involved in, this project that took place in my area involved training community health workers from the Traveller projects in Galway and Roscommon. I applied for funding under the Adult Literacy for Life funds to train the community health workers in relation to the 5 top cancers in terms of incidence and to co-design resources and messaging in relation to these cancers. They then in turn piloted the resources and messaging in their outreach programmes with Traveller families. I liaised with my colleague Anne-Marie in the Southeast and her work with Traveller health workers to develop and review resources also. We are now at the evaluation phase of this project, reviewing the content and appearance of the resources. Resources are A5 size back-to-back and include information on how to reduce your risk of the cancer and what are the signs and symptoms of the particular cancer in order to find cancer early. The 5 cancers include bowel, breast, skin, lung, and prostate. For those that have screening programs like the bowel and breast, information was given in relation to screening on the A5 leaflet also. I liaised with the National Screening Service in terms of this content. This is what the resources look like at the moment, and as I said earlier, they're being currently evaluated. This is another Traveller project that my colleague Anne-Marie was involved in, and it was through the Fishing Future programme in collaboration with the Traveller Mental Health Coordinator in Wicklow. It involved St. Cohn's National School in Rathnew pupils learning to fish in a safe environment where volunteer anglers provided the skills to fish to the students. As part of the programme, the children received wide-brimmed hats and sunscreen and were educated on being sun smart when outdoors through the use of sunscreen board and interactive quiz. The teachers in the school received the SunSmart lesson plans and SunSmart promotional materials to reinforce the messaging. The volunteer anglers seen here in the photo also availed of the sunscreen protection and education around being SunSmart. Just to flag some cancer-specific research with the Traveller community that is coming soon, and it's entitled Cancer Awareness and Attitudes Among the Traveller Community in Ireland, a co-designed study led by UCD in collaboration with Pavey Point Traveller and Roma Centre and the HC National Cancer Control Programme. The Traveller community health workers and Pavey Point were largely involved in the co-design and data collection for this research in conjunction with UCD researchers. At the Irish Cancer Prevention Network Symposium, the lead researcher, Dr. Patricia Fox from UCD, presented top-line results, including that 1/3 of travellers would not want to know if they had cancer, and older people over 65 were more likely to have negative views in relation to cancer. 60% of the respondents would discuss symptoms with their GP, but 40% identified talking to the receptionist about their symptoms as a barrier to presenting to the GP. A link to this talk will be provided in the post-webinar email, where other top-line results can be viewed with the full research report to be published early next year. Because lung cancer is one of the cancers reporting a higher incidence in the most deprived populations, one of the actions we have undertaken is to talk to our stop smoking advisors and our We Can Quit facilitators about lung cancer each year in November, as it is Lung Cancer Awareness Month. Our presentations aim to highlight signs and symptoms of lung cancer and the important role stop smoking advisors have in raising the subject of getting any new symptoms and changes to existing symptoms checked out by their GP. Example, a new cough lasting more than 3 weeks, as per Lisa's campaign in North Dublin, a change to an existing cough, breathlessness more than is normal, etc. We also talk about what the next steps may be for a client if they are referred for a chest x-ray or to the rapid access lung clinics by their GP. The hope is that this may reassure the client about the steps involved and help them present earlier with symptoms to their GP. Just to flag also a programme that Ireland are involved in across Europe in an EU for Health funded pilot in relation to lung cancer screening. The pilot is called a lung health check as opposed to lung cancer screening, with the hope that this will improve the uptake as a result. It is referred to as the SOLACE programme. The pilot in Ireland will focus on deprived areas with an age cohort of 55 to 74 years. There is a particular focus on groups that are at a higher risk due to health inequalities. The study will use low-dose CT scans and spirometry to screen people. A link to a presentation from Professor Patrick Redmond seen here with more information on this proposed lung health check pilot will be in the post-webinar email. I hope this has given you some idea of the work we are currently involved in relation to health inequalities in cancer. This important topic will continue to be a focus of our future work as cancer prevention, health promotion and improvement officers. Thank you for your time today.